All right, Shantala, let's get right to it. Why are women, do you think, at greater risk now of postpartum depression than ever before?
Well, one of the huge risk factors is when a woman feels socially isolated or that they do not have the support they need during a stressful time. So, obviously, childbirth and having a new baby is a huge stressor and life change. So, as a result, if a woman does not have that kind of connection due to social distancing, everything that's going on with the pandemic, people not being allowed to come into the hospital, not being able to visit, it can really be a huge stressor for women. And the problems that they had had before can be increased due to not having that support system.
Why are African American women at an even greater risk for, risk factors involved in postpartum depression or, childbirth complications for that matter?
Well, African American women have a higher rate of mortality in childbirth, as well as premature babies born to them. So, as a result, the stressors involved with having a baby are much higher for them than another racial group. So, they would be, as a result, more prone to postpartum depression because the postpartum depression involves that anxiety, that fear, that fearfulness that the baby won't be okay, that they won't be okay, that they won't be able to manage this. So when they have all those other physical stressors involved, it's just a huge problem.
So we know what it is. We know what to look for. But what can be done within the community, do you think, to support these women?
Well, we do have social media and we have technology now. So there are Facebook groups, there are Instagram groups, there are ways that women can connect and they can share their experiences and not feel alone. So I think it's really important that women, number one, know and understand that postpartum depression is always a risk. 1 in 7 women experience it, and there's nothing wrong with them if they're going through it, but also that this is going to be higher during this time because of the social alienation. So preparing themselves beforehand with ways to talk with other women, support groups within the area that are virtual, and being able to express and engage with the people that they love and making sure they can do that, but also being safe and practicing social distancing.
All right, licensed mental health counselor Shantala Boss, a frequent guest with us on the afternoon edition. Always good to see you.
You as well.